We're talking about osteoporosis.
Yes.
What is the risk, or how common is it among patients to have osteoporosis?
So I would say it's extremely common. I don't actually have the statistics on how common, but essentially 1 out of 3 women will get a fragility fracture in their lifetime, which is directly related to osteoporosis, and 1 in 5 men will get a fragility fracture in their lifetime, which again is directly related to osteoporosis.
Okay, so we know osteoporosis is decreased bone density.
Yes.
Soft bones, and a fragility fracture is a fracture through soft bone.
Yeah.
The thing I think many of us would recognize is our grandma getting up and falling and breaking her hip.
Yeah,
that would be an example
fall
of a fragility fracture, right?
Yep.
In the spine, we see a lot of compression fractures. Very, very common. It's common, and many of us will have a fragility fracture in our lifetime.
Yes.
What is the problem with a fragility fracture? Like, what is the consequence of it?
So a lot of consequences of fragility fractures. I think the biggest one is that there's a risk of mortality with them. So for a year after that fragility fracture, the risk of dying for events related to that fracture, for men, it's 19.5%. So 19.5% of men who sustain one of those fragility fractures have a risk of actually dying from complications related to it. And for women, it's 12.5%. So significant risk. In
the conference related to this, Brian Holzer and Eric Freeman talked about kyphoplasty, which is a treatment for compression fractures in the back. And they compared this idea of treating somebody to save a life. How many people would you have to treat to save a life? If you're treating with aspirin for prevention of stroke, you have to treat like 3,000 patients to save a life.
Yes.
If you're treating with kyphoplasty, you only have to treat 15 patients to save a life. So I think it's a good awareness for us to recognize just how much of a problem this can be.
Yeah.
So as far as screening goes, I think people recognize more and more women should be screened for breast cancer at certain ages. We should all be screened with colonoscopy past maybe the age of 50, men for prostate issues. What is the screening recommendations for osteoporosis?
Yeah, and I think I hope that that's probably one of the key takeaways for patients is to advocate for yourselves. All women over the age of 65 should get screened with a DEXA scan. You can talk to any of your medical providers about getting that done. Primary care usually directs it, but get started somewhere. For men, it's all men over the age of 70. And then if you have additional risk factors, then you should get screened even earlier than that.
That's really good. Really good. And we as providers need to be better at advocating for screening, which is part of the reason why you spoke and why we're doing this video. But definitely get screened. So say somebody is at risk for osteoporosis or they have osteoporosis. Aside from the medical treatment, because I think that gets pretty complicated, what can a patient do about it?
Yeah, so the big thing is going to be reducing any risk factors that you already have. If you're smoking, stop smoking. If you're sedentary, you've got to get physically active, build stronger bones. You've got to look at nutrition. Are you taking calcium and vitamin D and protein? And then looking at the physical activity side of things, really focusing on high intensity training, resistance training, and then balance activities. So things like yoga, Tai Chi are going to help prevent falls.
So I think that's excellent advice. And the good news is that the resistance training and modification of risk factors can help to build the bone back and prevent future fragility fractures and other complications related to osteoporosis.
Yeah, I think a lot of people think that osteoporosis is just something that's inevitable. They can't stop it. Once they get it, they can't reverse it. But it is reversible, it is treatable, and it is preventable.
Very good. Well, let's do it.
Yep.
Thanks.